What is intersection syndrome? Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and today we look at a cause of wrist and forearm pain called intersection syndrome. Now, I was recently browsing through the latest edition of the BMJ Open Sports and Exercise Medicine Journal, and I came across a paper that mentioned intersection syndrome in relation to causes of wrist pain in elite rowers. Now, I must be honest and say I have never heard of intersection syndrome, but living in Waikato, near Lake Karapiro, which is the home to New Zealand's elite rowing facilities, I do see the odd rower, so I thought I should familiarise myself with this syndrome. So for those of you who share my ignorance on this condition, intersection syndrome is an overuse injury of the wrist, and whilst it has been called oarsman's wrist, it is also seen in other repetitive activities that involve wrist flexion and extension, such as weightlifting, skiing, trail bike and motocross riding, some racket sports and horse riding. It is called intersection syndrome because the site of the inflammation is the point at which the first dorsal compartment, containing abductor pollicis longus and extensor pollicis brevis, crosses, or intersects, the second dorsal compartment containing extensor carpi radialis longus and extensor carpi radialis brevis. The patient reports pain to the dorsal forearm and wrist, usually made worse by flexion and extension. When you examine a patient with intersection syndrome, you should find that they have tenderness over the intersection. This is about 6 centimetres or so proximal to Lister's tubercle on the dorsal aspect of the wrist. Lister's tubercle is also called the dorsal tubercle of the wrist and is palpated right at the end of the radius on the dorsal side. You might also elicit crepitus, particularly in wrist extension. Now, a distal forearm tenosynovitis I had heard of is de Quervain's. This is a differential diagnosis of intersection syndrome, and apparently the two get mixed up commonly. The difference is de Quervain's is a tenosynovitis of the first compartment only, and the pain is more distal than intersection, more over the radial styloid region. X-rays are not helpful. This is a clinical diagnosis, but obviously in the setting of trauma, they are useful to exclude fractures and other pathologies. Ultrasound scan shows peritendinous edema and might help you confirm the diagnosis, but MRI is the best imaging modality for those lucky enough to have access. Treatment involves rest, avoiding the aggravating activities, and I would refer these to a registered hand therapist for splinting and ongoing management. I have found mention of steroidal injections being done too, but there is also a surgical procedure to release the second dorsal compartment. This is usually considered a last resort, but that brings me back to the start of this podcast. The article I came upon in the BMJ Open Sports and Exercise Medicine Journal is titled Intersection Syndrome, an Acute Surgical Disease in Elite Rowers. It was published in June this year and authored by Gregory Hoy et al., and I've linked to the open access paper in the show notes. Interestingly, they encourage early surgical intervention in elite rowers because it allows early return to sport and prevents the technique change that rowers go through to avoid aggravating their injury, thereby decreasing their performance. So this is an example of how management can sometimes differ in elite sports people. So if your patient is an elite level athlete, it's probably best to refer on to a sports physician or upper limb surgeon to manage. So I'm now wondering if all these years I've been labelling the intersection syndrome as a de Quervain's tenosynovitis or non-specific soft tissue injury of the forearm, but I will certainly now be more aware of the intersection of the first and second dorsal compartments of the forearm. I link in the show notes to an Orthobullets page and a Radiopaedia page on this topic, alongside the article mentioned above. Please send any comments, corrections or suggestions to podcast@rnzcuc.org.nz. We'll be back again next week with another podcast. I look forward to seeing you then, but for now, thanks for listening.